Hi all. Today we'll discuss how to take a past medical history, an essential part of every clinical consultation. Once you've explored the presenting complaint, you need to understand the patient's background health, as it often gives context to their current illness. Past medical history helps identify predisposing factors, recurrences, and complications that shape both diagnosis and management. For example, a patient presenting with headache may have a past history of migraine, which immediately becomes relevant. Similarly, someone with hematemesis and multiple minor injuries may have a history suggesting excess alcohol use. In another case, a person with peripheral vascular disease might have underlying diabetes, or a patient with chronic cough and sputum might have had whooping cough as a child, predisposing them to bronchiectasis. Although referral letters and previous medical records are useful, the patient remains your best source of information. Always take the time to ask directly and listen carefully. You can structure your questions around 4 key areas. First, ask about past illnesses. Say something like, have you ever seen a doctor before for any significant illness, or have you ever been diagnosed with any long-term conditions? This helps uncover chronic diseases like hypertension, diabetes, asthma, or epilepsy that may influence the current problem. Second, ask about hospital admissions or clinic visits. Have you ever been admitted to hospital or attended any specialist clinics? This can reveal previous treatments, procedures, or complications you might not find in the records. Third, inquire about past surgeries. Ask, have you ever had any operations? Note not just the procedure, but also when it occurred and whether there were any post-operative issues. Finally, ask about current medications. Do you take any medicines regularly? Is a simple but vital question. Medications can both point to underlying diseases and affect how new symptoms present. Don't forget to include over-the-counter and herbal preparations, as these can sometimes interact with prescribed drugs. Throughout this conversation, keep the tone conversational and non-judgmental. Patients may forget details at first, so gentle prompts or time cues, like in the past year or since your childhood, can help jog their memory. To summarize, the past medical history gives valuable context to the presenting problem. It helps you connect current symptoms with past illnesses, uncover risk factors, and understand the overall health of your patient. A good clinician always balances medical records with the patient's own story, because no one knows their history better than they do. Thank you.